What are you putting in your brains these days? What are you training your brain to think about?
What's really important is developing the right foundation to learn.
I like to think about the big vision. I like to think about, well, I want to do this, but I don't want to go do all the details. Just here's what I want, go paint my numbers and let's get it done. It's about relationships. So yes, do all the other stuff too, or do other things, but this is so easy to do, so automated that I think you're foolish not to try to do it.
You don't have to do all this marketing stuff. You don't have to do the social media. You don't have to. What you have to do is you have to have a leader in the practice who can do it. And I mean a leader, not a volunteer. The difference between leaders and volunteers is that volunteers show up and leaders are committed.
In order to change, we must be prepared to train our mind and not work on our business, but work on ourselves first.
If you're living a high quality life and engaging, I've got a feeling that your team members are going to feel that. They're going to see your joy and it's going to pour into them. And they're going to take that joy and it's going to pour into the patients. When you have people in the chair and you're not in the room, how did your staff talk about you? If you're living a good story, the odds are they're relaying that to your patient.
I think that the #1 barrier to being successful in implants is practicing as an island. In other words, you get results, but since no one's looking at it, the information is not fast enough. So by the time you get the feedback, either you've hurt somebody or you think it's acceptable. We as dentists have a tendency to practice as islands. And until you develop a network of support, you're never going to be able to advance fast enough to get it. The technology is happening too quickly. You can't do it by just reading, by just being associated with yourself.
The ratio between deposits and withdrawals is about 3 to 1. How many positive experiences have you deposited into your patients or your business associates' emotional bank account this last month?
If you want to lead your team to the top, you have to know where you're going. And it's important that as the leader of that team, whether you're seeing yourself today here as the owning dentist, or you're seeing yourself here as a clinical team leader or as administrative team leader, it's important that you have a compelling vision of the future. Capital isn't scarce, vision is. So as you think about your practice, you think about your business, you need a compelling vision that's going to keep your team focused on the goal. You need a vision that's going to help you stay after it.
I was consulted by a single dentist one time for my practice. I hired a coach to come in and work with me, and I realized within the first coaching session that this wasn't going to go anywhere because he was about a $500,000 practice consulting us when we were about $5 million. He could not relate to what we were doing. He didn't know about the group dynamics. And so that's what I've committed to do, is to put out there that we can coach the single practice, because I built 2 practices from scratch as a single dentist, but then I've added an associate, 1, 2, then 3. And so that's the level that we want to play at, is to show people how to grow their practice from the bottom to the level they want to go.
The problem is that we're trading time for dollars. We're trading our labor for the dollar. And I don't care how high a dollar value you produce at, you're still trading your time for that dollar. It's very inefficient. Yes, you can do some things with business offsets, but I'm talking about however you take the income out of your practice. We're sitting there, we're the low-hanging fruit. And with what's happening in the economy, what's going to happen in the future, people like us, the professionals, we're going to be attacked. We're the ones they're after. We're the ones they think they're going to float this debt on.
Everybody has a unique need. So think through, why would your patients choose you? And don't answer that in just a 30-second quick response. Marinate over that. Take it to your team. Ask your team members, why do you think our patients choose us? When I'm not in the room, what are people saying about us? Wrap your team into this question, because they are just as big a part of your brand as you. You set the tone, but they carry it out.
Whoever that is at the top, he didn't get there by falling, right? He got there by climbing. And he probably did some falling along the way, but you can't fall all the way up to the top of a mountain. You've got to do some climbing. It all starts with what? It all starts with the first step. There's a difference between being good and being great. You see, good is the enemy of great.
When you set the right goals, your actions increase. And that's because when you set your goals, when you really sit down and establish your vision, and you find your calling and what you know that you're good at, what you love to do, what's your passion, you get excited, don't you?
So we have to learn to be who you are, be original, and connect with people. It might be a new thought process for some of you to actually take it this far, but when you realize that the human relationship is going to drive everything you do, it'll significantly change the impact that your business carries.
I've seen a lot of dreams come true and a lot of happy people. Seeing people change and seeing the results in their life, it affects more than just themselves, family and all types of people around them. So I love the quote from Gandhi. He said, "Be the change you want to see in the world."